My name is Tracie Martin. I am with CHRISTUS Healthcare Systems, and I am the Vice President of Provider Compensation and Contracting. My visibility into provider compensation, having everything in the Hallmark platform has really allowed us to, especially those very first few business days of every month, has eased up on some of the responsibilities of our analysts, and they're able to more easily go into the providers that they oversee and see what their calculations are and just make sure there's not any nuances or any weird things going on. So just the ease of transition, and they're really more now looking for trends and variances, as whereas before they were using Excel spreadsheets and making sure that there weren't any calculation errors. The specific outcomes that I have seen in the implementation was we do have providers that are going into more routinely and checking their comp and then asking questions. But really just more my direct team, I feel like there's been a weight lifted off of their shoulders. They're not feeling so responsible for ensuring that their formulas are right in Excel, or that we've got the right data coming in through our EMR system. That just goes right over to Hallmark. So just a lifted to the burden from the analyst perspective. I think that every CFO should know what automation does for you, the time that you receive back to be able to respond to other things other than just comp calculations or managing variable pay elements. There's so many other things that CFOs don't realize that a provider comp and contracting team is responsible for, just that whole time that you get back. And so you're really able to use your labor more efficiently. You're able to use more critical thinking skills because you have that extra time to just kind of think through some things that you didn't have before when you were doing manual. For the physicians that are using the platform regularly, we are getting positive feedback. Our big push right now is because we've been live for a little bit over a year, is really getting them to go into the platform more. We have a CMO that's working with us that's really helping, be the mouthpiece for the physicians of, hey, you really need to go in there to see it. But yeah, it's been positive. They like the transparency. They like to see where they're trending on their count calculations. The biggest thing that I hear from them, though, is they like being able to see what they're getting paid for, as opposed to going and trying to find their pay stub and trying to figure out what the pay stub says.